Please provide an overview of Stop TB Partnership. ストップ結核パートナーシップはどのような団体ですか？
Stop TB Partnership is hosted, it's a United Nations hosted entity. We're based in Geneva, and we look to catalyze, advocate, coordinate the work globally of over 2,000 partners in the fight to end TB. We lead the global advocacy and communications around TB, advocating for a higher profile of TB globally, for more resources to fight TB and end TB. And we have another group that works to provide diagnostics and treatment to countries, TB high-burden countries, globally. And the work that my team does is really around coordinating a network of technical partners to roll out, to introduce, roll out, evaluate, and generate evidence for new technologies, new approaches to identify more people, reach more people with TB diagnosis, and link them to care.
Are there any challenges you are facing in your global health efforts? グローバルヘルスにおける取り組みで直面している課題があれば教えてください。
I think the key challenge, the biggest challenge that we have in TB globally is that every year, every 1 out of every 4 people who develops TB, who get sick with TB, is missed by national TB programs. So that is probably the biggest reason why TB is the single largest killer of any infectious disease. It kills 1.3 million people every year. It's more than COVID, again, after several years of COVID being the leading infectious disease. The main reason is we don't reach all of the people who get sick. And there's many reasons for that. There's poor access to TB diagnostics, and the TB diagnostics that we have currently, although we have some good ones, we're not reaching everyone with those diagnostic tests. The TB programs historically have been very insular. They've been focused on waiting for people who are sick to come to them. So we need to go outside of the routine health facilities to reach more people with TB care where they live, where they work. They can be outreach efforts to nomadic communities or internally displaced populations, tribal areas. They can be marginalized communities in terms of transgender populations or sex worker populations that don't have the same access that the general population does. And so we do a lot of outreach, and then we test out new tools that are being developed and provide evidence for these new tools so that if they are impactful and they work well, national programs and global at the global level, we can generate policy that allows the uptake and scale up of these approaches or new tools.
Please tell us about Stop TB Partnership's collaboration with GHIT. GHIT とストップ結核パートナーシップはどのような取り組みを協業していますか？
Sure. So the partnership with GHIT is a really exciting one. There's a new TB test that uses urine instead of sputum, and sputum is difficult to produce for many people, certainly for young children, people who are living with HIV, but also often other populations struggle to produce good quality sputum. So the idea of a test that can be done with urine, for example, it's much easier to collect, and it can be done with minimal processing. So the collaboration with GHIT is to test out a new test that Fujifilm has developed. It's a lateral flow urine LAM test. Fujifilm LAM 2 test is a new updated assay that has the promise of not only being able to use for people living with HIV, for example, but potentially could be used in a general population. And this would allow much more coverage for diagnostic tests. And if we can use these very small urine lam assays, we could reach far more people because we can test them in more remote areas, more remote facilities, provide access to TB testing for more people. We need to work on making sure that it performs well in different populations. We need to make sure that the price is accessible for TB programs and that it's available. And the best way to do that is to provide a strong evidence base and have WHO recommendations to use the test.
Do you have any messages to global health partners in Japan and overseas? 日本や海外のグローバルヘルスのパートナーに向けてメッセージがあればお聞かせください。
It's a very different situation, scenario than what it would mean to diagnose TB in Japan or a lower TB burden country with many more resources. So thinking about how to best place new technology in high TB burden countries is something that often requires a lot of discussion and dialogue with manufacturers to understand what the market needs and how best placed we can help them for a successful product and ideally they sell their product because it's impactful technology. So I think that dialogue will really be important going forward.
GHIT Fund. Fight neglected diseases through partnerships.